All right, can you guys hear me? Is the mic on? Can you hear it okay? Okay. Well, thank you so much for the introduction and for having me here tonight. If at any point you can't hear me, let me know, okay? And this is pretty informal. I'm going to go over kind of the major types of skin cancers. And if you have questions or don't understand, please let me know and we'll address it. And I'll have time at the end too, so we can go over stuff then, okay? Linda pretty much introduced me, did everything. I'm from Colorado originally. I love the outdoors, and Colorado just got too busy for my husband and I, so we love it up here. So tonight we're going to go over what is skin cancer, what causes it, how do we recognize it so you can help me help you, how do we treat it, and how do I prevent skin cancer. And this is my niece, Olive, and I think I bought her this cute little outfit. So she will not get skin cancer because she lives in the Cayman Islands and she's super fair. So 1 in 5 Americans born this year will develop skin cancer in their lifetime. So we know that the incidence of skin cancer is very high and it affects everyone in some way. So why is this important for all of us? The skin is the largest organ in the human body. It forms waterproof protective wrap over your entire body. It serves as a barrier to infection, and it helps to control your body temperature. It does some other cool things like vitamin D synthesis, which is not so important up here because we really don't get the right UV radiation. The average adult human skin has a surface area between 16.1 and 21.5 square feet. And in just 1 square inch of the skin, there's approximately 60,000 melanocytes. And these are the cells that give pigment or color to your skin. There's over 1,000 nerve endings, 650 sweat glands, and 20 blood vessels. So the skin is super complex. So here's just a nice pictograph of what your skin looks like when we look at it microscopically. There's basically 3 layers. So the top layer is the epidermis. That's the outer layer. That's the area that provides the greatest barrier. It's also where we get the most sun damage and see where our skin cancers arise from. The second layer is the dermis. That's where all the blood vessels, the hair follicles, sebaceous glands, or your sweat glands, that's where they arise. And then the next layer is the fat layer. And that's just kind of lots of fat, lots of blood vessels, not so important for us today. Just a closer look at the top layer. You can see you've got lots of different cells here, and this is where we're going to see most of our skin cancers are arising from. And then again, the second layer, more in depth of the hair follicles, the blood vessels, nerve endings. Not so important for skin cancer today, but very interesting for me. And then the last layer, which hypodermis or subcutaneous tissue, and that's where all your fat is. So nearly half of all new cancers are skin cancers, and more than 1.5 million new cases in the US this year. And I'm going to have you believe by the end of this that the sun is not your friend. So what is skin cancer? Well, like any cancer, it's out of control growth of abnormal cells in that top layer of skin that we talked about, the epidermis. It's usually caused by unrepaired DNA damage that triggers mutations that leads to this out of control growth. And then the skin cells multiply rapidly and form malignant tumors. So the 2 main causes of this out of control growth is the sun's harmful rays, the UV rays, and tanning beds. We also are finding out that genetics plays a big role in some types of skin cancers. And so if you have the right combination of sun exposure plus the genetic makeup, you're at a much higher risk for skin cancer. The good news is that we can see the skin. We can see the tumors forming. And so if it's caught early, we can oftentimes treat skin cancer with relatively no scarring and really high odds of eliminating it entirely. And oftentimes we can even detect abnormal growth at the precancerous stage before it's even become a skin cancer. So that's what we want to, that's our main goal, is to help you guys detect when you've got new precancerous lesions that we can treat early. So ultraviolet light, we'll just talk about it really quick. There's two things that we're most concerned about, the UVA and the UVB. You might hear these terms thrown out a lot. So the UVA, these are the tanning rays. This is when you go to Hawaii and you get your tan in January. So it penetrates pretty deeply into the second layer of skin. It causes suntans, sunburns, and sun damage. It breaks up a lot of that collagen tissue, and if you have chronic sun damage, you get lots of wrinkles and that leathery brown skin, which I saw all over Florida when I was training there. The UVB, this is kind of referred to as the burn index. It causes suntan, sunburn, and sun damage as well, but it also causes that long-term sun tanning, I think, which I saw a lot in Florida, where just people are leathery skin. And both of these can lead to skin cancers. So effects of sun exposure. You can have permanent destruction of the skin supporting structures in the second layer of skin, premature wrinkling, the precancerous lesions, drug reactions. So if you're on medications, oftentimes the sun can have an effect on your skin. You can have a horrible rash. Eye damage, it affects the eyes the same way as the skin. It can lead to early vision loss. Dilated blood vessels on the skin, sunburn, and of course skin cancer, which is what we're most concerned about today. So again, here's my top layer of skin. This is the outer barrier, the place that's most affected by the UV rays. And just of note, if you see the green cells on the bottom, those are melanocytes, and we'll talk about those when we talk about melanoma. So here you see, a picture of this beautiful baby skin, no sun exposure, next to, a weathered hand that's obviously been exposed to sun. And so we know that sun causes a lot of damage over our lifetimes. Lots of wrinkles and hardening of the skin. So who's at risk for skin cancer? Well, I'm going to tell you anyone can be at risk, because I've seen skin cancer in everyone. But people who look like me are probably at the highest risk. You have very fair skin. I'm considered skin type 1, so I'm pale. I pretty much always burn when I get into the sun and hardly ever tan, and I've got blue eyes. So I've got every risk factor. Skin types 2 and 3 are also at pretty high risk, and so these are people who still burn and they may or may not tan. However, like I said, anyone can get skin cancer. Bob Marley died at a young age of a melanoma that just wasn't detected in time. So anyone can be at risk. So this is actually a picture of myself. It was in one of my mentors' slide set for his skin cancer talk. My father was a photographer, and it just cracked me up. I was sitting in his lecture when I was a medical student, and I saw my face flash across the screen. And it's funny too, because at that time I wasn't in dermatology residency yet. I was still striving to be there, and there I am. So I am at very high risk, and if you have any redheaded people in your family, they are at high risk too. We actually, new studies have just recently shown that there is a genetic defect that we have that leads us to a much higher risk of melanoma. So we need to be very careful in the sun. So other people who are at risk besides myself, medical and industrial X-ray exposure can lead to an increased risk. If you have scarring from diseases or burns, scars have an increased risk of skin cancer. Occupational exposure to compounds such as coal tar and arsenic. And arsenic in well water can cause squamous cell carcinomas and precancers. Family history of skin cancer is important because it tells a little bit about your genetic makeup. Immunosuppression is very important. If you organ transplant patient or on long-term immunosuppressive therapies, you have a very high risk of squamous cell carcinoma and then an increased risk of melanoma and basal cell carcinoma. So the types of skin cancer, there's actually a lot, but the three most common are basal cell, squamous cell, and then melanoma. And so that's what I'm going to focus our talk on today, because that makes up 99% of skin cancers, and that's what's most relevant and most important for you guys. If you have questions about the other stuff, that's what I love, so I'll be more than happy to talk to you about it. So basal cell carcinoma, this is the most common form of skin cancer. There's more than 4 million cases per year that are diagnosed in the US. Basal cells are abnormal, uncontrolled growths that arise from the skin's basal cells in the epidermis. So it's the very last layer of that top layer of skin. Most often they develop on areas typically exposed to the sun, so face, ears, neck, scalp, shoulders, and back. And most basal cells are caused by a combination of intermittent intense exposure and cumulative long-term exposure to UV radiation from the sun over your lifetime. And so while basal cells rarely metastasize, they can be locally destructive, and they will just continue to grow and bleed and cause problems. So what does it typically look like? Usually we describe it as this pearly papule with some blood vessels that are running through it. However, the bump can also be tan, black, brown. It can be confused with an ordinary mole. So just so you know, dermatology is not always so easy. I don't always know when I look at something. Oftentimes, a patient will say that it was an acne bump that won't go away, or it continues to bleed or ooze. So anything that continues to do that for 3 or more weeks really causes alarm for me, and I think that I need to biopsy this and find out what's going on. Sometimes it can just be a little crusted patch that doesn't heal. Or it can sometimes be white and waxy, almost like a scar. So here I have a whole bunch of pictures of different types of basal cells at different stages. So the first, you can see that some of them look just pearly and kind of raised. Some are ulcerated with some crusting, and some have some pigment, so they almost look darker in them. And then here you can see a little bit of scar on the, can you see the arrow on there? Yeah. So in here you can see it almost looks like a scar, but then there's these funny little bumps in the center. And then these two basal cells are pigmented and almost just look like a mole. So here an important thing is to notice anything that's new or changing. Basal cells change pretty slowly for the most part, unless you're immunosuppressed, and then the change could be rapid. So the next type of skin cancer I'm going to talk about is squamous cell carcinoma. It's the second most common form of skin cancer, and it's an uncontrolled growth of abnormal cells arising from the squamous cells in the epidermis. There's more than 1 million cases that are diagnosed in the US each year, and this is usually caused by cumulative long-term exposure to UV radiation from the sun, and tanning machines cause most SCCs. As well, they're common on sun-exposed areas such as the ears, face, scalp, neck, and hands. This is where the skin often reveals signs of sun damage, including wrinkles, pigment changes, age spots, and broken vessels. SCCs can sometimes grow rapidly, and they can metastasize if they're not detected early. And if patients immunosuppressed, they tend to be a lot more aggressive. That just depends on the patient's status. So if you're young and healthy, that typically would take a while. But if you're older, immunocompromised, that could happen in 1 to 3 weeks. Yeah, so it really depends on the patient's status and how healthy you are. So what does it look like? It can look like a lot of different things. Sometimes it looks like a basal cell. Sometimes it looks like a wart-like growth that crusts and occasionally bleeds. Basal cells tend not to be symptomatic, so they're usually not painful. However, squamous cells often do elicit some sort of uncomfort feeling, so pain, a little tinge. So patients usually feel this. It can be a persistent scaly red patch with irregular borders that sometimes crusts and bleeds. And elevated growth with a central depression that occasionally bleeds, and it may rapidly increase in size. So here's some other examples of squamous cell carcinomas. This one's on the back of the hand. Probably this one's very verrucous or wart-like. This one's more crusty, and then this is on the lower lip. The lower lip is a common place to get squamous cells just because you get so much sun exposure and it's hard to cover it, and it's hard to protect it with sunscreen. Actinic keratoses are actually the precursor or pre-cancer to squamous cell carcinomas. So this is something that we often look for on a skin exam, is because it helps, if we detect it at the actinic keratosis level, we can prevent them from becoming squamous cell carcinomas. And it also gives us a good insight into the sun exposure history of the patient. If they are covered in actinic keratosis like this patient, all these little red crusty spots are just precancers all over. This patient has had lots of sun exposure and is at high risk for skin cancers. And the actinic keratosis, if they're left untreated, up to 10% or more can turn into squamous cell carcinomas. So it is recommended that we treat them because we can do it in a non-surgical fashion. So treatment of basal cell carcinomas and squamous cell carcinomas, if they are invasive when we biopsy it, then surgical excision or Mohs surgery are usually indicated, especially if it's on the head and neck, because that tends to be a more high-risk area for nerve invasion and for spread of the cancer and local destruction. However, if they're superficial, we have lots of different treatment options. So there's topical chemotherapy creams available today. Radiation is actually a pretty good treatment for superficial skin cancers. And then there's this thing called electrodesiccation and curettage, and that's a scrape and burn method. It's old, but it works really well. And then there's some newer targeted therapies specifically for basal cells, which are for special patients who have really bad genetics and who are getting basal cells at the age of 10. There are now medications that are available to help prevent the progression of the basal cells. So that's not for everyone because it has some pretty bad side effects. So the last skin cancer that I'm going to talk about tonight is melanoma. So melanoma develops from melanocytes, and those are the cells that give pigment to our skin. This is the most dangerous and most aggressive of the 3 most common forms of skin cancer. Melanoma is often triggered by the kind of intense intermittent sun exposure that leads to sunburns. Tanning bed use has also been shown to increase the risk for melanoma. This year, they estimate that there's going to be more than 87,000 new cases of melanoma, and almost 10,000 melanoma deaths occur each year in the U.S. So melanomas often resemble moles, and they sometimes may arise from a mole. However, they can also arise from nothing. And the big take-home point for us tonight is that melanoma in situ is 100% curable by surgery. However, if it is allowed to progress, it can spread to vital organs and become life-threatening within months. So the AAD, which is the American Academy of Dermatology, came out with some guidelines to help us educate patients and yourself about melanoma and how you can detect it early, because honestly, patients, or the patient's wife, I should say, usually is the one who detects the melanoma. So A is for asymmetry. So if we look at the picture of the melanoma there, if you were to draw a vertical line and a horizontal line, in a normal mole you would have equal halves or equal quarters. In melanoma you start to see a lot of asymmetry on those sides. B is for border irregularity, so uneven scalloped borders, notched edges. C, color variability, so different shades of brown, tan, black, with progression to colors such as red, white, and blue. D is for diameter, so a diameter greater than 6 millimeters. And then E is for evolution, so anything that's changing, either size, shape, color in a short period of time. And these are just guidelines. So if you have a mole that is 1 millimeter, it's never changed, it's brown, but you say one border is asymmetrical, I'm probably not going to be too alarmed by it. But if you have 3 or 4 of these things in one mole, then I would definitely biopsy it. So different examples of melanoma, and these ones are all pretty advanced melanomas here. You can see the one on your left, I guess, has lots of different colors, scalloped borders. It's very large. This is actually a little superficial in-transit metastasis, so there's a little bump of new melanoma rising next to it, that little pink area. And then this is a very large nodular melanoma. And then this one on this older gentleman's face is probably a lentigo malignant melanoma, which is probably a sun freckle that has progressed into melanoma. So how do you treat melanoma? Well, like I said, if you catch it early and it's in situ, we can cut it out, and you probably will never see melanoma from that one ever again. It's 100% curable. However, treatment after that depends on the stage of the melanoma, which takes quite a bit of workup. So it depends on the depth of the melanoma, which we look at after we cut it out. We look at it pathologically, and the pathologist helps us to decide how deep it is. It also looks at how rapidly the cells are dividing, how ugly they look. We look at lymph nodes sometimes depending on how deep the melanoma is. Sometimes it's appropriate to do scans to see if it's progressed. And so depending on which stage will really predict how it is treated. There are a lot of great new medicines out on the market today for melanoma. Immunotherapies that help your immune system recognize the melanoma and fight it off, and really great success stories. Before that, there hadn't been any progress in melanoma treatment in like 30 years. So it's an exciting time, I guess, for melanoma cancer treatment, if you can say that. So how do we prevent skin cancer? This is the fun part of the talk. There's a lot of things that we'll go over. Most of them you probably know, so this is kind of fun, and I'm just going to kind of reiterate what to think about. So limit your time in the midday sun. And I was thinking about this, and I don't know quite how to adapt it to the Fairbanks summertime, because our midday sun is all day long. So, and it's pretty intense all day long. So I think if you, I've gotten sunburn at 7 o'clock at night. So in the lower 48, I would suggest that you stay out of the sun's rays between 10 a.m. and 4 p.m. and limit your exposure during these hours. Up here, I would say you're probably gonna, if you're gonna be outside, you're gonna have to adapt a lot of the other suggestions that I have for you, such as seeking shade. So staying under cover is one way to protect yourself from the sun. Just remember that the shade structures don't offer complete protection. This is my nephew on the beach in the Caymans, and while he's covered up, he's still getting a little bit of scattering of UV light from the sand, and if he was closer to the shore, you could get that scatter of light off of the ocean. So he's got his sun protective hat on and his sun protective clothing and sunscreen, because I make sure of it. So cover up like my niece, wear your sun protective clothing. Long sleeves pants is a good way to protect your skin. There's so many outfits and different products available now that lightweight you can wear, that are breathable, that protect your skin. So anyone can do it, and they're affordable too. Use sunscreen, absolutely. So I say put sunscreen on every day, even in the wintertime up here, because you just never know how often you're going to be outside. And I say at least a 30 or higher. Apply generously and reapply often, especially if you're going to be outside. So how much is enough? They recommend at least a teaspoonful for your face, and then about a shot glass full for your body. So you want to be pretty greasy. Wear a hat, and this is my baby. This is Peyton. So I'm so ashamed to say, we went to San Francisco and we got sunburnt. All of us got really sunburnt. And so first thing I did when we got back is bought her a hat, and she never goes anywhere without it now. I felt so bad. I felt like the worst dermatologist ever. But yeah, a hat with a wide brim. It offers good sun protection for your eyes, ears, and the back of your neck as well. See, my husband isn't so smart because he's already got those little precancers on his ears, and he still refuses to get a broad brim hat. He won't wear one. So I keep working on him. Wear your sunglasses. It protects from the sun damage. This is my baby again, Peyton, with her sunglasses. Avoid tanning parlors. They do cause sun damage. They do cause skin cancer. There's been numerous reports recently. And some people say that they need to get their base layer tan. The base layer tan does not provide much sun protection, maybe a sun protective factor of 3 or 4 at most. So it's not worth the risk of getting a skin cancer. And we're seeing the rise in melanomas and non-melanoma skin cancers in young women, 30s, 40s. So they are way too young to be getting skin cancer. So don't let your daughters go get suntans. Watch the UV index. I just Googled this today and it showed us the UV index for the next 3 days in Fairbanks, and we've got, it says about almost 5 it was at. So it says it's high, but not extremely high. And that's all I've got for you. This is Peyton. She says it's over. She's rolling over.